stopping by again. I'm Sally Jacks. This is my YouTube channel where I've been talking about the ferritin, of course the low iron deficiency, and I have one amazing woman with me again that works at the Iron Clinic, 60 Harley Street, with Professor Toby Richards. You are a trainee surgeon. I know, amazing. Can you imagine being that, going home saying mum and dad? My mum and dad be so pleased with me. But actually now you're working with the research here because you found it so fascinating. Now you are really the person, Dr. Sandy, to talk to about the facts and figures of ferritin. Now ferritin is your iron stores.
Absolutely. So according to the NHS, what they look at is a guideline of between 5 and 250 for your ferritin. But actually we know that if you're a young, fit and healthy woman, then you should be having a ferritin of around 100. And if it's less than 30, then we know that you have what's called relative iron deficiency. And if it's less than 15, then we consider you as having absolute iron deficiency.
Which is you're not
absolutely wiped out.
Even though it's not 0, it's only 15. You are
absolutely.
You have nothing in the tank.
Exactly. The reason for this confusion is because ferritin, it's like a little store. It locks your iron down. It's like 100 iron molecules locked in, so that it isn't free, because free iron in the body is toxic. And the reason that it's confusing is because it's also an inflammatory marker. And the way that our bodies evolved was, if you look at all the really dangerous pathogens, your bacterial viruses, they tend to be very reliant on iron stores and iron to grow. So as a result, our bodies have evolved to shut down that iron in times of inflammation. And therefore your ferritin goes up if you've got active inflammation.
Do you know, this is what's just happened, because I've just asked my husband, when I was in the GP surgery with him, he had an inflammation, had a kidney stone, and I said, would you check his ferritin? There's no need, they said, because his ferritin is going to be very high, because he's got inflammation or an infection. So if you are getting it checked and you are in that area, then it's not going to be a proper reading unless you get your trans ferritin saturation, which doctors would never do.
No, and that is something that we're looking to change. We're educating more and more people about it. So with your ferritin, you should do a TSATs, trans ferritin saturations. You should also ideally do your inflammatory markers. So your CRP along with your full blood
count. What's the CRP? Is that your serum iron?
No, CRP is C-reactive protein, which is like an inflammatory marker. And it will tell you whether there's any active, it's very sensitive. It will tell you whether there's any active inflammation, infection going on in your body. And that, along with your white cell count and your full blood count, that gives you a bigger picture of if there's anything going on. That might be the reason why your ferritin is artificially elevated. And therefore people will think, oh well, do you know what, that person's got a normal ferritin.
So I know you're going off the GPs. I know you said 5 to 200 and something. When I looked at my GPs on my ferritin levels, it was actually saying 10 to 291.
Right.
Those were the levels they were giving. Why is my GP saying that my ferritin, I mean, I know it's a simple question, but why is it saying that it's fine at 24? Well, why were they saying it was fine at 8 when my ferritin was 8? Why is that? Yet I was still going in with my hands not able to move, my skin had gone blue, and my feet I was unable to move. So it was obviously that I was drained of iron. Why are they not seeing this?
It's just a lack of knowledge. Unfortunately, the world of iron has always been a little bit behind, and a lot of our research, the cutting edge work, has been done in the last sort of 10-15 years. And now we know that iron affects everything in the body. It's not just anemia, it's not just your bone marrow. We know that it affects muscle, we know that it affects nerve cells. So there are these little powerhouses in each cell called mitochondria. And they're the ones that produce your energy, your ATP, your ADP. And they're in nerve cells, they're in muscle tissue, they're in every cell, to be honest. And they are all, the processes within those little mitochondria are heavily reliant on iron. Every little part of that Krebs cycle has a lot of iron in it. And therefore, it's not just your anemia that's affected, but you can have muscle fatigue.
So it's what I've had.
Absolutely. You can have nerve conduction problems, so your inability to concentrate, depression, anxiety, brain fog.
Well, I've had brain fog, I've had anxiety, I've had irritability. I wouldn't say I've had depression, although maybe I have. Sometimes I have felt a little bit low, but that's it. When I think of depression, I think of somebody that's not able to get out of bed, and although that's how I feel in the morning because I don't want to get up because I'm so flipping tired. But all of these things that I've had, but you know, when I go to a doctor's, do you know what they say? Oh, let's have a look at each individual thing. We don't want to look at the whole pack, but even if I did look at the whole pack, I think you're perimenopausal. Which of course you go, what? It's not, I'm too young. I mean, I know it can happen to people that are younger, but surely not. You know, and even now, even though I've been back to my GPs, and I went to my mum's GP with her because her ferritin was reading 32. She's got the same symptoms as me. She's always suffered with anemia all her life. And we went to her GP, and he told me he was training in iron, and that the optimum levels for iron were between 30 and 50. That's what most of his patients were, and that's how he knew that that was what the optimum levels were.
So this is something that was thought about in the past, and to be honest, even now, people think women should have a hemoglobin of 120. But this was based on some very arbitrary assessments done on a very small number of people at the time back in the 60s. So a certain population, I can't remember the exact numbers, but it was a handful of women had their blood sampled, and the average, the optimal level decided statistically at the time was 120 for women and 130 for men.
Yes.
But now we're actually looking at saying everyone should have 130 because women have a smaller blood volume. If you bleed surgically, you bleed the same amount, it doesn't matter. And therefore you're more likely, if you start at a lower level, you're more likely to fall lower. And if you fall lower, then you're more likely to need a blood transfusion. Why do that? Why have all the negative effects of blood transfusion, the immunosuppressive effects, the reactions as a result of blood transfusions, when if we were educated from the start and we had a good level optimized pre-operatively beforehand, all these things, they're now only just starting to infiltrate medicine.
But why is it taking so long? Why is it taking so long? I know you're not here. I know you're not. I know you're the same as me. You're just gumming. But why is it taking so long for GPs to get this knowledge? But it's not just GPs. It's surgeons.
Yeah, absolutely.
It's cancer doctors. It's midwives. It's everybody, isn't it?
Absolutely.
Because iron, mostly affecting women, affects everything.
So 10 to 15% of women, this is my little soapbox thing,
Yeah.
10 to 15% of women will experience anemia and an iron deficiency. And the problem here
There's
is
a difference between those two
yes, so you can be, this is another topic
that everybody gets confused about.
Yes, so you can still be iron deficient but have complete normal hemoglobin.
That's me.
Yes.
So my hemoglobin's fine, but my iron isn't, and that's why I've just had the...
And the reason is that your body is very good at using what little iron stores that they've got, and it'll absolutely need rock bottom iron levels for a long, long time before your bone marrow goes, oh, I've had enough, I can't make enough red blood cells anymore. And at that point, then you become anemic. You kind of fall over that cliff edge.
So eventually I would become anemic.
Yes, absolutely.
Yes.
Yeah.
Okay.
And the aim is ideally to get you before you get there. And that's what, again, the symptoms of iron deficiency are so insidious. They're very non-specific, it makes it very hard. In some ways, you have to feel bad for clinicians because, especially GPs, they've got 9 minutes to see everyone, to diagnose your problem based on, a variety of different symptoms.
Yeah, and they do work very hard.
Absolutely, and therefore, and even then, everyone is on the back burner in terms of iron.
Yeah, but to me, the way I look at it, and I know that you're going to agree with me, when you look at a lot of symptoms that people have, so thyroid, it could be down to your iron. Heart problems, it could be down to your iron. Depression, it could be down to your iron. Anxiety, it could be down to your iron. Sleepless nights, it could be down to your iron. So let's look at that. Thyroid problems like thyroxine you're taking. Let's talk about depression tablets, anxiety tablets. What do you call it when it? Antidepressants. What's the one that helps you sleep? Sleeping tablets. That's the word I'm looking for. My brain fog. This will be better after 8 weeks. All these things doctors are going and prescribing medication for, which is costing the NHS even more money, because if you go on to something like sleeping tablets, if you go on to something like thyroxine, if you go on to something like antidepressants, the chance of you coming off that is very slim. So therefore it's costing the NHS more and more, especially if that person is maybe a pensioner, so they're getting it for free, or they're on benefits, and we're having to pay for all that, whereas that person doesn't really need to be on that. Possibly, because it could be down to their iron stores.
Yeah, absolutely.
And it's frustrating.
It is.
I don't know how you work in the area.
Do you know what? When I had my baby, 6 months later, I had a cesarean section. I lost a lot of blood. I breastfed for 7 whole months exclusively, and I felt absolutely rotten at the end of about 6 months. And I tried to get a blood test done and tried to ask for a ferritin, and it was just so difficult. It was difficult to convince anyone to say, because the thought process was, I'm a young mum, I'm up in the night breastfeeding, I'm tired.
We've actually been having a laugh with the doctor in there, Dr. Rao, because he's a man, and we were saying, you said,
yes,
he said that if this had been a man that had all the problems with the menstruating, with the giving birth, with it being sucked dry of iron with giving birth to babies, which is a fabulous thing, I know it's amazing that we do, but when you feel like rotten at the end of it, if that would have been a man, something had been done about it a long time ago.
10-15% of women, absolutely.
Yeah, it's sexist, but it's probably true. It is true. Just quickly before we get going, because I could prattle on for hours about this. Just tell them about the mice. Just tell them about the mice.
Yes.
Because I was saying, can I run a marathon now? I've had this, and she went, you might do. Some people have.
Yeah, and the way that we look at productivity with regards to iron deficiency is we need to change our thought process. And some of the earliest research work done was looking at tea pluckers and how much they were able to harvest plucking tea based on how anemic they were. These poor women had terrible diets, probably mostly vegetarian, didn't really have any red meat. They were from Ceylon, which is a small island, ironically, where I come from.
Oh, is it?
So very, very proud of that heritage.
Yeah.
But, again, they had anemia, and they were given ferrous sulfate, iron tablets, and then they were reassessed to see how much they were able to harvest, and they found the weight of the tea that they plucked increased. So this increased after having oral tablets. Absolutely. And the same goes for most recent cutting-edge technology research work done, looking at mice. Running mice on treadmills, they can run super fast, they can go up to about 4 kilometers per hour for little mice. And some of them were given to compare iron deficient diets. Because one of the ways that you lose iron is through your skin cells. When you're exercising, you shed the skin and you shed the iron in it, and you don't regain it. And after being given an iron deficient diet, they found that those mice that became anemic and iron deficient, they slowed down, they fatigued quicker. And then they were replaced their iron by giving intravenous iron through their tail vein. And then you saw their times started improving again, and they were shorter, they were quicker not to fatigue. They carried on, really.
Wow. It's an amazing story, isn't it? And I'm hoping it's going to happen to me. I'm hoping I'm going to be that little mouse and I'm going to carry on running because I'm hoping all these symptoms are gone. If anybody at home now thinks, hang on, I think this is me, what would you recommend for them to do?
Go and see your GP. Very important to have your GP on board to let them know that you've had these symptoms and ask for a blood test. Please, can I have some bloods taken, particularly looking at iron? And you can say,
Ferritin.
Ferritin is important, but also transferrin saturations.
Transferritin saturation.
TSATs, yes. Very, very important. And a full blood count. Those are the 3 basics that you need. Ideally, you should also have other blood tests, including B vitamins and folate, to check that they're all okay.
So that's like your B12 as well,
That's right,
isn't it?
yeah.
What are the Bs? Is it
So B12 and folate.
and
Those are the
folate?
2.
So that's folic, obviously your folic acid. That's why they say to take folic acid when you're pregnant. But everything that we're saying right now, if you actually go and have a look at, I think there's a product on the shelf, might be called Pregnacare, something like that. There's another one that Nicole Scherzinger is on the front cover of.
Oh, yes.
I can't remember what that is, but it's about nails, hair and teeth. If you actually read all of those, that's exactly what we're talking about. We're talking about iron, we're talking about B12, we're talking about folic acid, things like iron and zinc. It's all in these tablets. So they're a great thing to take, but of course, if you're completely low, like I was, almost drained, it's never going to get back up there, not even with ferrous sulfate. Caitlin was telling me that it could have taken me sort of 8 months to 12 months to get back up to any sort of level.
Absolutely, because your gut can only absorb a certain amount, so between 6 and 20 milligrams a day, and according to, we use something fancy called the Ganzoni formula.
Oh, wow.
That's how we calculate how much iron you need. It's a brilliant name. It sounds very Italian. And what we're looking at is 20 milligrams per kilogram of your body weight, and that gives you your iron stores. So for the average person who weighs about 75 kilos, we're looking at 1,500 milligrams. So that, divided by 20, gives you the number of days. And remember, if you take iron on one day, then the next day you won't absorb it, because there's a type of hormone produced by your liver called hepcidin, which it stops your gut from absorbing too much iron, basically.
And thank you so much. Honestly, I could witter all day, and we're
So
loving
could
our
I.
pearls, aren't we? It's been lovely, because I'm hoping this is the answer to my prayers, and it could be yours. Please don't forget to subscribe. Keep following this. I'm going to get as much information and keep telling you the tale and the story of my progress. And if you've got any problems at all, go to your GP, get those blood tests done, and you can actually send them. Am I right that you can send them to this iron clinic for free, and you can have a look at those blood tests for them?
We're very happy to.
So this is the iron clinic. I will leave you all the details in the description below. So don't forget to subscribe. Don't forget to give us a thumbs up. Love you lots, and I'll see you tomorrow. Thank you.
Bye-bye.
Bye.